Hello, and welcome to COVID-19 Infection Control for Laboratories. My name is Kelly Ogle. I have a master's in organizational psychology and my bachelor's degree in dental hygiene. I am also the director of OSHA and HIPAA services for doctors management and not. So when we talk about the transmission of the COVID-19, we don't know a lot about the COVID-19 or the coronavirus that we are dealing with. We're learning very quickly about how it's caused, how it's spread. And so this is similar coronaviruses that cause the SARS and the MERS, and they spread from person to person. And it's usually within close contacts of the people that are infected. And they may not have symptoms. They could be a carrier for those for the coronavirus. And so if they are a carrier and they're not having symptoms and they could be infected, we have to be within about 6 feet. They're generalizing about 6 feet because of the projection of droplets that can occur. So this transmission usually has the respiratory droplets, and they're saying that if someone coughs or sneezes around in that area, if you're within 6 feet, it's possible to catch it. And then also it's possible to catch it by touching a surface with respiratory droplets on it. If someone sneezed in the in the area before you, and then you come along and touch it, then if you're touching that and then you're touching your mouth, nose, or even possibly your eyes, more likely an airway because this is affecting your lungs, but they're testing also to see if it could be through the eyes also. But it's not thought to be the main way of how the virus spreads. In general guidance, all laboratories should perform a site-specific and activity-specific risk assessment. What you're going to do is identify the risks that you have within the laboratory based on the procedures that you're doing. So it depends on the procedures, the identification of the hazards involved in the processes that you're doing or the procedures, and the competency level of the personnel who perform those procedures. It also provides, on the training that you've had as far as knowing what you need to do within the laboratory, and then the laboratory equipment, the facility, and the resources that are available to you. With continued general guidance, we're going to always follow the standard precautions when handling clinical specimens. This could contain infectious materials, so we're always going to consider that it's going to be contagious or infectious. That's what standard precautions is. And this is going to include hand hygiene and the use of personal protective equipment, such as laboratory coats, gowns, gloves, and eye protection. Now, respirators and surgical masks will be discussed later into the PowerPoint, so we're going to discuss when to use those. Follow routine laboratory practices and procedures for decontamination of work surfaces and management of laboratory waste, and we'll discuss those later also. Virus isolation in cell culture and initial characterization of viral agents recovered in cultures of the SARS-CoV-2 specimens are not recommended at this time, except at a biosafety level 3 laboratory. So it is not recommended that we handle those if you are not a biosafety level 3 laboratory. Specific guidance, also routine diagnostic testing of specimens, such as with the following activities. This can be handled with the BSL-2 laboratory using the standard precautions, using the automated instruments and analyzers, processing initial samples, also staining and microscopic analysis of fixed smears, and examination of bacterial cultures. So making sure you're using the standard precautions, like I said, wearing all the gowns, cleaning, doing everything that you need to do, but also when you're doing these procedures. Some more specific guidance includes pathologic examination and processing of formalin-fixed or otherwise inactivated tissues, molecular analysis of extracted nucleic acid preparations, also final packaging of specimens for transport for diagnostic laboratories for additional testing. And these specimens should already be sealed and decontaminated in the primary container. Using inactivated specimens, such as specimens in nucleic acid extraction buffer, and then also performing electron microscopic studies with glutaraldehyde fixed grids. When we're talking about decontamination of the work surfaces and equipment, you must have the appropriate disinfectants. So if you read on there, they have to be EPA registered hospital disinfectants, and they have to make the claims on the back that they are effective against the SARS-CoV-2, or it'll say coronavirus. Follow the manufacturer's recommendations of the use, such as the dilution, contact time, and safe handling. So if you're using these EPA registered hospital disinfectants and you're not following these manufacturer's recommendations, they're not going to do what you need them to do. For example, if you don't wait long enough for them to stay on the surface, it's not going to kill the COVID-2. Laboratory waste management. You want to handle laboratory waste from testing suspected or confirmed COVID-19 patient specimens as all other biohazardous waste in the laboratory. Currently, there's no evidence to suggest that this laboratory waste needs any additional packaging or disinfection procedures. You're still going to use the standard precautions. You're going to make sure that you're covered and that you put them in that waste that you normally put everything else into, protecting them into the red bag or the regulated bag. Standard precautions. Assume that every person is potentially infected or colonized with a pathogen that could be transmitted in the healthcare setting. The elements of standard precautions that apply to patients with respiratory infections, including COVID-19, are summarized on the next slides. Attention should be paid to training, definitely training, in making sure that people are doing the proper donning and doffing, or taking on, putting on, and taking off of the PPE, and the disposal of the PPE, making sure they're not using them at times that they may already be contaminated, and handling things that they shouldn't be handling. The healthcare personnel, or HCP, who enter the room of the patient with known or suspected COVID-19 should adhere to the standard precautions. So if you are in a lab that does some testing and has a patient within that lab that comes in there or sits to have something drawn, you need to make sure that you're using the precautions of a COVID-19 patient and you're wearing a respirator or a face mask, gown, gloves, eye protection. If the respirators are not available, okay, then face masks can be used, but it is recommended that respirators, because they are preferred and they are going to protect you the best. They should be prioritized for the situations where respiratory protection is most important, especially for caring for those that have the airborne precautions, or you're worried about tuberculosis, measles, and also the same thing with COVID-19. Infection control. You want to ensure that disinfection procedures are followed consistently and correctly. You want to clean and disinfect and use those procedures such as using cleaners or water to pre-clean surfaces before applying the EPA registered disinfectant. So cleaning the surfaces off beforehand, getting rid of any debris or anything else, and then disinfecting the surface. If there's anything blocking the surface for any reason, anything underneath that could still be contaminated. So we want to make sure to clean the surface first off with just, soap and water or whatever, and then go back with the EPA registered disinfectant and clean off those surfaces or objects that the appropriate contact times are indicated on that label. This is also appropriate for the SARS-CoV in any healthcare setting. Decontamination of the surfaces. The purpose of this is to protect the employees. It is also to protect the patients, but as far as OSHA is concerned, CDC also, we're worried about the employees. If we don't have the employees to take care of the patients, we're not going to get anything done. Decontaminate the work surfaces using the EPA registered disinfectant and following the instructions as listed on the manufacturer's label. And then contain contaminated items for transport in the sterilization area. You don't want to take them out or walk them out in an area that is not contaminated at the time. So do it in the area that you're working in, contain those contaminated items, and transport them over to the sterilization area. Preferably you want to use the disposals, that way you can dispose of them in that room and you're not having to carry them. But you want also, if you have any sharps, do not carry them out of the room. If they are disposable, you want to put the sharps into the sharps container. Clean the instruments. Pre-soaking is the best. You want preferably a covered, labeled ultrasonic cleaner. And then if you have to scrub, you better wear your personal protective equipment, and also you're going to scrub any instruments or anything that you have to decontaminate or also sterilize. You want those underneath water, not running water, but a tub of water and submerged in the water, because you're wanting to reduce the amount of splatter or splash that you're going to have. So be sure that you do that also. When we talk about hand hygiene, the healthcare professional should perform hand hygiene before and after all contact with potentially infectious material. Before putting on and after removing any PPE, this includes your gloves. Allow time for your hands to dry before you put the gloves on. If you've used any kind of sanitizer also, or hand sanitizer, make sure that you are going to let those dry also, because you don't want to put the gloves on. Sometimes it can cause a breakdown of the gloves. Hand hygiene after removing PPE is particularly important to remove any pathogens that might have been transferred to bare hands during the removal process. So being sure that you do proper hand hygiene is very, very important, especially for spreading to the employee themselves. But also the removal of the personal protective equipment is very important, and how you handle it before, washing or potentially contaminating yourself, and then going to hand hygiene. The healthcare professional should perform hand hygiene by using an alcohol-based hand rub. You need to use at least 60 to 95% alcohol, which is contained in the hand rub, or washing hands with soap and water for at least 20 seconds. If the hands are visibly soiled, use soap and water before returning with the alcohol-based hand rub. Healthcare facilities should ensure that the hand hygiene supplies are readily available to all personnel in every care location. Making sure that we wash our hands at least part of the day, some point through the day, is very important. Using those alcohol-based hand rubs are efficient if you are using them correctly. But when we get in a hurry and we're working with our patients or working in our job, doing our tasks, sometimes we don't allow the alcohol-based hand rub to sit on our hands long enough and to do its job. It's just like any chemical that you would use. When you are disinfecting something, you have to put it on the surface and wait for it to dry. So it has to do that on your hands the same way. You cannot go and use your hands still damp. It has to dry on the hands, and you have to use enough of the alcohol-based hand rub to do its job. So make sure that you get enough on your hands and saturate the hands and work behind, around your hands, wrists, everything. Personal protective equipment. Healthcare professionals must receive training on and how to demonstrate the understanding of when to use the personal protective equipment, what is necessary, and then also how to put it on, use it, take it off, in a manner to keep or prevent self-contamination. How to properly dispose or disinfect and maintain the personal protective equipment, and the limitations of the personal protective equipment that you're using. It's very important that you understand which personal protective equipment you must be using, especially in this situation with COVID-19. And the best protection that has been actually recommended by the CDC and OSHA itself is to make sure that you wear the glove, gowns, face protection, anything that's going to protect you from the aerosols that you may come in contact with if you come in contact with someone that has COVID-19. Respirator and face mask. Put on the respirator or face mask if the respirator is not available. This is only if it is not available. The respirators are the best method to prepare you into entry into the care area or wherever you're going to be testing any kind of samples or anything that you could be exposed. Disposable respirators and face masks should be removed and discarded when exiting the care area and closing the door. Perform hand hygiene after discarding the respirator or face mask. So making sure that if you are around or testing any kind of specimens that you could be exposed to that could be a COVID patient, and you're doing any kind of testing, that you make sure to take care of yourself. This is the most important part. Disposing of those and also doing the hand hygiene anytime that you can possibly do that to protect yourself. Eye protection. Goggles or disposable face shields that covers the front and the sides of the face. Personal eyeglasses, contact lenses are not considered accurate or adequate eye protection. Remove eye protection before leaving the area, and reusable eye protection such as goggles must be cleaned and disinfected according to the manufacturer's reprocessing instructions prior to reuse. Disposable eye protection should be discarded after use. Making sure that you wear the appropriate eye protection. Making sure that it's going to cover your face well enough that if you come in contact with it or if someone coughs in your direction, that it doesn't get on your face. So you want that face shield. You want as much coverage as you can possibly get in these when you're worrying about the COVID-19. Put on clean, non-sterile gloves upon entry into the area. Change gloves if they become torn or heavily contaminated, and remove and discard gloves when leaving the area, and immediately perform hand hygiene. I can't tell you enough how many times that you need to perform your hand hygiene constantly. If you weren't doing it enough before, you're going to do it enough now. You need to make sure that you're doing the proper procedures. Put on a clean isolation gown upon entry into the area. Change the gown if it becomes soiled. Remove and discard the gown in a dedicated container for waste or linen before leaving the area. Disposable gowns should be discarded after use, and cloth gowns should be laundered after every use. So, in the case when we're walking into a laboratory and we're working in a laboratory, you don't want cross-contamination. So it's very important that you do change out your gowns or any coverings that you have, the cloth gowns or anything that you're using. You don't want cross-contamination if you were to touch something. That's why you're changing your gloves. That's why you're changing your face masks or cleaning them. We don't want cross-contamination in our samples. Disinfection. This is a better slide on the information about disinfection. Routine cleaning and disinfection procedures, cleaners and waters, pre-clean surfaces using the EPA-registered disinfectant, and those appropriate for SARS-CoV-2 in the healthcare settings, including those areas in which aerosol-generated procedures are performed. Management of medical waste should also be performed in accordance to the routine procedures. So not a lot is going to change as far as what we should have been doing, okay? And I say should have been doing because a lot of us may have been a little bit lax on what we were doing before. We need to make sure that we're taking care of ourselves, washing our hands, wearing the personal protective equipment that we should in case of an exposure. If you have any questions, you can reach out to Doctors Management. Again, my name was Kelly Ogle. I am the Director of OSHA and HIPAA Services for Doctors Management. Our resources today came from cdc.gov. If you have any questions, they have a thorough understanding and review of this information. Please contact CDC if you have any questions, or you can give me a call or reach out by email. Thank you very much and have a great day.